Hello and welcome to Health and Wellness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to the Health and Wellness podcast. My name is Michael Swartz, Certified Financial Planner and Certified Physician Development Coach. Today we have an awesome guest. Her name is Dawn Elfenbein. She is a medical professional, a physician at the University of Wisconsin-Madison. She is also a Master of Public Health and Fellow of the American College of Surgeons. Her current position is Vice Chair of Wellbeing in the Department of Surgery at UW-Madison. And with that, Dawn, welcome to the podcast.
Thanks, Michael. Happy to be here. Thanks for having me.
Yeah, absolutely. And just to give a little bit of context for our relationship, Don, we met actually at the Champions of Wellness presentation at the conference there. Um, and obviously, as, Vice Chair of Wellbeing, tell me a little bit about your role and what you do professionally.
Yeah, thanks. Yeah, it was great to meet you at that conference. That was a really cool conference, a really small group of people, kind of Midwest regional local people that got together and just try to figure out kind of how to make life a little bit better for the people around them in the healthcare field, because I think well-being is something that is in front of people's minds, I think, as work changes in this area. So yeah, it was great to meet you there. And the way that I got into being the vice chair of well-being, I've spent most of my career as a surgical educator. So I started out before I went to med school as a high school teacher, and then went to med school. So I approach everything from really an education and kind of teacher. I see myself as a teacher first. Did a lot of teaching of med students, and realized that over the course of that, I guess not realize, I kind of knew this the whole way, but it became more and more important, is that the learning environment and how people sort of interact and learn is so much more important to how they retain that information than the information itself, right? So spending time on content is important, but really focusing on that actual environment is more important. I think that extends far wider beyond education into the workplace environment. And so when this opportunity came up, I jumped at it and sort of have been spending the last year really thinking about this. What does well-being at work actually mean?
Well, it's amazing that you recognize that. And so for the listeners out there, we'll spend this first conversation talking about the environment that Don's experienced change or shift maybe over the course of her career. And then, in the second conversation, talk more about your retirement transition and journey. But why don't you take us back, Don, to you mentioned, going through those early years of education and into teaching. How has the environment shifted as you've seen it over time, and what are you doing to address that?
Yeah, surgeon has a really intense training environment, right? So as I mentioned, started out as a high school teacher, went to med school with the intention of being a pediatrician and a sort of public health professional. I'd seen that the intersection of health and education was really, really potent. Like a lot of the things that my kids were having trouble with in high school wasn't really directly related to their ability to learn, but it was related to their hunger, or they're taking care of a sick kid or parent at home, or things like that. And so that was kind of how I came into med school, with that mindset. I think then I just fell in love with surgery, honestly, and couldn't see myself doing anything else. And so then embarked on this surgical journey. And surgical training is this very intense 5 to 7 years of completely breaking down everything you ever thought you were and rebuilding you
Mm.
into this surgeon, right? Like, I don't know of many other things that are so transformative, or for people. And it really is, there is this idea of what a surgeon is, and surgical training is about teaching those skills, but it really is about remaking kind of how you view the world and how you respond to different things. Um, and a lot of that is not very positive, right? A lot of that is the sort of losing of yourself, I think, through that. I think then the next transition to being an attending, having my own surgical practice, was a tough one, because I think a lot of the skills of leadership, a lot of the ability to sort of control your own environment, none of that stuff was taught to you during residency. You were sort of a victim of your own environment. You just had to get through it. And so there was a lot of learning going on there of how to kind of create the environment that I wanted to. And gosh, I don't know where I'm even going with that next, but that has been the journey so far, and I think I'm still on that journey of trying to figure out, in this really complex healthcare world that has changed a lot, even in the last 5 years since COVID,
Mhm.
how can we respond to the things that we have some control over, in this big system where there's a lot that we don't have control over.
Yeah, and I think really what you were describing is a period of time through residency where the environment really dictates the individual. And at least
Hmm.
for you, it sounds like post-residency and into attending and having your own practice, you kind of got to reclaim that agency, but it had been lost along the way or forfeited for the sake of success or at least getting by. And
Hmm.
I think a lot of physicians are going to resonate with that sense of losing their identity, losing their agency. And at least for you, it sounds like very early in your career as an attending, though you come back and say, "Hey, I've got this again." But there was this
Hmm.
rebuilding and kind of re-nurturing of that. Hey, I've got the control over this. How do I build it the way that I want it to? Kind of what do I want?
Hmm. Yeah, I think that's right. And I think that, I've always been in academic settings as well. So I haven't experienced life outside of an academic medical center. And academic medical centers can be very big, complex places, but they're always a place where there is some teaching and learning that is happening. And so I really found that agency by latching onto any of those leadership opportunities to be directly involved in the teaching, and not just teaching, but what should we be teaching, right? How can I become involved, and how can I be the person that makes the decisions about what it is important to actually teach med students, not just doing the teaching? So I think that that's how I kind of reclaim some of that autonomy, is getting into the teaching leadership roles.
Awesome. Well, now, with a leadership role in well-being too, what are some of the major challenges that you see younger physicians, mid-career and late career physicians facing?
Yeah, I think for younger physicians, this might be something particularly potent in surgical departments, but probably is happening everywhere. We are, I think, very appropriately and necessarily recruiting a more and more diverse group of people to go to med school, to do surgical residencies, and to become surgeons, because there's a lot of data out there that says that that is better for the American public to have, surgeons who are taking care of them, who have similar life backgrounds, who look like them. Like that, just having a more diverse workforce as surgeons is incredibly important to provide high quality care. I don't think that the surgical training environment has evolved beyond the sort of self-sacrificing
Mm.
traditions that were set up when surgeons were mostly, to be frank and honest, white men who had other people at home, partners who were raising their kids for them, right? And so the complexities of bringing in lots of different people to do this, which we have to do, it is imperative that we do this, the training environment lags far behind that, and being able to sort of make accommodations for that when we say we want it, it hasn't happened yet. We haven't really done that, and so that's got to be very frustrating for residents to hear all the time, we want you here, but we're not going to really provide the right supports to be able to allow you to thrive here.
Yeah, as you mentioned,
So,
just shifting that environment, but at the same time, big ships steer slowly, right? And
mhm,
so
mhm,
we've got these wants, these desires, these needs, but the environment is what it is, at least for now, and really
yeah,
being intentional with that change. And it sounds like, at least for younger physicians, coming out of
mhm.
residency, maybe doing a fellowship and entering, those early attending years, it can be a challenging environment to say the least.
For sure. Yeah. And then you get to where you thought for, 10 years or more where you wanted to be. Now you're mid-career, right?
Yeah.
And there's a whole other shift and changes there, right? There's this other perspective of I'm finally good at what I do. I don't have to think about this every single day. I don't have to prepare as in depth as I did for every single case or clinic or whatever it is. And then and I have $250,000 in debt from med school that I'm paying back slowly over time and things like that, right? But for some reason, I don't feel as satisfied anymore, because I think a lot of us are strivers. We love to be learning new things, and then when you kind of reach this point in your career when you're not learning new things anymore, it's like, well, now what, right? I think a lot of people do go through that mid-career kind of, is this what I really wanted to do or not? And I've always found that I love taking care of patients. I love doing surgery. I also feel like I always have to be actively doing something that's making the environment around me better, whether that's education or well-being, and spending some time thinking about those bigger pictures is so important for me, to just stay engaged.
Well, I don't want to use the metaphor of blinders because it feels a little bit restrictive, no pun intended. But it seems like, at least for surgeons in general, in my experience with clients and others that have been through coaching, surgeons have a very narrow field. I mean, they're just their focal point is very centered. And so when you mention this kind of coming back up for air, a lot of these elements of their life have come together. Kind of, you started the family, you've got the student loan debt, and you've got this cadence. And
Mhm.
now the things that you're striving to get to, you've reached. You've accomplished these things, or at least they're in a wash, rinse, repeat pattern.
Yeah.
Where does that tie into that sense of agency and that sense of identity?
Yeah, I think that's a hard question. And I think that, we'll get to this in the later part of our conversation, but I think I struggled for a long time with that of like, is this because I think that I don't know, at a certain age, maybe you turn 40 or something like that. Maybe that's the age because it takes so long to train to be a surgeon. And maybe 40 is the age where you're suddenly like, okay, now I'm there. I've reached it. I can do all the things. Is it really just going to be the same thing for 25 more years, right, until I retire? And so I think that I did struggle a lot with that. I was 40 when I had my kid, and that kind of changed things for me and for my spouse, kind of personally, just kind of taking a look at what is it that we want to how do we want to raise our kid, right? What kind of values do we want to impart to them? And so I think that that was for me one of the big things that really kind of helped bring that agency back because I was a little bit on cruise control a little bit before that did happen. So for some people maybe that happens professionally. For me, it happened kind of on a more personal level.
Well, and as we mentioned, right, that professional cadence kind of gets in set in place, and now you have the freedom to build around that, whether that's your personal
Hmm.
life, family life, and for you, you mentioned the word values, and I'm wondering,
Hmm.
in the well-being space, what is the importance of knowing your values, whether that's for your family or for yourself?
Yeah, and gosh, I do like a values exercise with myself every 6 months or so to really really delve in there and see are the core values that I think are the things that drive me still the same, and they have changed a bit over time as the environment changes, honestly, because we look at the world, with a different set of eyes than we did 5 years ago or 10 years ago or so. But I think that that is so critical for people to understand what is the thing that really drives you, and I think that that to go back a little bit in time to one of your prior questions, I think there used to be a type of person, a more homogeneous person who had certain values that align with being a surgeon. I think now there are a lot of people with lots of different values that also want to be surgeons, and that's where it's getting really challenging is how do you make surgical training and surgical specialties or surgical practice something that aligns with people whose values are something, not along the traditional sort of striving and perfectionism and all those kinds of things. What do you do with someone whose values are, uh, providing really good patient-centered care, or their value is, humor or gratitude or kindness or things like that? Like, how do you bring that into a surgical training and value those things highly? Not that values is the wrong word, but reward those things, I think, highly.
Yeah, and maybe tailor the practice or tailor the practice of medicine to those values so that you can really express yourself with your greatest strengths, right? We don't want to judge a fish by its ability to climb a tree, but we do need to judge a surgeon by their ability to do the surgery itself. But
Right.
however, the periphery of that it falls out, it sounds like totally permissible. And maybe
Hmm.
having a little bit more malleability instead of so much rigidity in that. And that's really what you're striving to create
Yeah,
in your space.
for sure. Hmm.
Excellent. Thank you. So now we'll talk in general first here, but what have you seen as far as surgeons or in education? What is it that late career physicians are facing in terms of challenges and opportunities once you get over that hump, that mid-career kind of identity? Where am I doubling down professionally or finding things outside of work? Okay, we got that taken care of. Now we're nearing the end of our career. What do you see
Hmm.
in that realm?
Yeah, I think that this is also another thing that I think is changing, and we'll get to this with my sort of retirement plans later too. But I just gave a presentation about this and really kind of dug into a little bit of surgeons and retirement. And there's the financial side of retirement, and we'll get into that a little bit, well, but then there's the sort of identity side of retirement, and being a surgeon, training to be a surgeon and being a surgeon is such an all-encompassing thing that we really internalize that as our identity more often than other careers, right? I asked my uncle who owns sprinkler installation, business. I say, "What do you do?" And he says, "I install sprinklers for people." You ask me what I do, and I say, "I am a surgeon." I don't say I
Yeah.
do surgery on other humans. I say I am a surgeon. And so I think that loss of that identity for people is a really fearful thing as you approach the end of the career. What in the world am I going to be if I'm not a surgeon anymore? Right. And so that I think is a huge, huge thing that we don't talk about enough. We do a lot of financial preparing and we talk about all these things to end a career, but what does it mean to no longer be a surgeon, right? Is it just that you're stopping doing surgery, but you're still a surgeon, or what is it that actually mean? So I think, remaining relevant at the end of your career, I think is a fear that a lot of older surgeons do have, right? Do I have all this experience and all this knowledge, but do the residents, look to me as a holder of experience or knowledge, or just as one of the old people that practices in an outdated way, right? I think that that's a big fear that some people will have as well. So I think that those are a lot of the big things that face people at the end of their as they get older. I won't say the end of their career, but as they get older.
Yeah, just aging, and yeah, I've heard, proper phrasing is a tenured physician or senior
Yeah,
physician, not an aging physician, right?
right,
And
exactly.
so in that realm, I like to talk about the spectrums. And so in this instance, there's a full spectrum of there are senior physicians who are absolutely the sage and well polished in their career. But even just last night, we're running a group coaching session here at Gunderson Health Systems on La Crosse, and one of the physicians comes in and they say, we could see it with other physicians who are in their later 50s, early 60s, where a few of the technical abilities just start to waver a little bit. And there's some cognitive issues or cognitive challenges just with aging itself that we kind of pull those in and say, okay, so if I am a doctor, I am a physician, I am a surgeon, and all of a sudden those abilities almost start, the sands of time are flowing through our hands, and with them our abilities to perform this craft.
Yeah.
How challenging is it to first almost reconcile that reality and then almost simultaneously transition from the career into a brand new world? It's transformative to enter retirement, especially if you don't know what you're retiring to.
Yeah.
It,
Gosh,
and that's
if I had the answer to that question, I would, like I could start a business of my own. But yeah, there's there's no one right way, is there?
no,
I
it's
Yeah,
terribly unique. Yeah.
yeah. It's hard. I think one of the things to recognize is that that's just a part of being human, right? Is that losing some ability over time. And I think that's challenging for surgeons because we have so many graphs of we know exactly how people gain a new skill in residency. And we have all these graphs and all these like wonderful data about how, you gain in technical ability and then cognitive ability and then finally that all elusive like just, sage who just seems to know things. But we don't have the opposite side of that. But of course, there's going to be some decline in all of those things in technical and in cognitive ability. And we kind of, we self police this a bit, right? We say that people need to just understand when they can't do certain things anymore. But then we live in a really big complex system where we do things like share call, right? So do we, decide to let someone who feels that their cognitive abilities are declining take less call because you know what that means? That means I have to take more call, right? So that is it's complicated. There's no one right answer to how to get people to look at that. But yeah, absolutely. I think part of it is just recognizing that and saying if this isn't the thing I'm going to do for the rest of my life, what other things can I cultivate to speak to those core values of mine that will continue to make life satisfying through all the phases of
Well, I think you're doing a tremendous amount of foreshadowing here. And so,
it.
in our next episode, we will be talking in depth about what you will be retiring to. And you had made a very strong comment there that resonated with me. You said, well, if I could figure that out for people, I'd have a very good business. And as you said earlier too, financial planning, everyone knows financial planning has been synonymous with retirement planning. And as a CFP, I've seen that too. People know to seek out professionals at the nearing the end of their career. They've been self managing their finances, accumulating and investing. And then there's this paradigm shift, 180-degree shift from saving to distributing, right? We completely turn upside down how we generate and receive income. And yet no one was talking about the personal retirement planning. So the financial retirement planning is taking place. The personal retirement planning is really piecemeal together. I call it the shotgun approach, where we're talking to other folks who are nearing retirement. We talk to retired friends and maybe attend a retirement planning workshop. And so really the whole reason that I've gotten into this physician development coaching piece is I've seen folks with really good retirement plans do really well in retirement. And I've seen folks with really good financial plans not do so well. And that's what got me so excited when we started talking. My colleague was actually the one that met you, and he goes, Michael, you got to come meet Dawn. She's got this really cool story about her retirement plan. And so I want to recap our conversation here and also get people really excited about next week's episode. Your retirement plan is inspiring. I'm not saying it's perfect. I'm not saying it's flawless. I don't want to put you up on too high of a pedestal. But to your point of navigating your values, really reconciling your retirement plan with who you are as an individual outside of I am a doctor, I am a surgeon.
Mhm.
It's really inspiring. And so as we wrap up this first conversation, Don, any advice for those early, mid, or late career physicians that you have to put an exclamation point on this part of the conversation?
Yeah, I think to just kind of state the same thing that I already did is that recognition that that we are human, right? Like that we are humans who take care of humans. We are not doctors, right? That this somehow superhuman thing. And part of the human condition is that all of the things that you learn will someday be less relevant and you will someday be less good at those things. So really getting down to what are my core values and how can I continue to cultivate ways either through work or through other things that can further those values. And I would say that this vice chair of wellbeing role that I've taken on has really changed the way that I view work, and it's given me some skills to look at my life outside of work. Honestly, I'm learning things through this vice chair of wellbeing role that have helped shape the way that I view a lot of things in my personal life as well. So it doesn't have to be that, work is one thing and personal life is another thing. I think if you're finding things that are in aligning with your values and always increasing those skills, I think that that's something to keep a lookout for. Even when you're in this autopilot mode of I can do the surgeries, I can take care of the patients.
Yeah, and I hear you talking about just the lowest common denominator of who I am as I show up in the different roles in life and what each
Yeah.
role allows me to express and which values it aligns with. I love that idea.
And we don't teach that in residency, right? We very purposely sort of strip people's values from them in residency. We say you will become what I think you're supposed to become, right? We like train
Yeah.
these specific things in people. So it's hard to get past that.
Yeah, what are the spectrums we talk about just for the listeners is it's a spectrum of rusting of internal compass. And at a minimum, it's a rusting of internal compass as we make sacrifices for our career. In the middle, it's adopting the values and priorities of the healthcare system. And all the way up on the high end of that is corporate Stockholm syndrome. And we've talked about that at length. There's a psychologist who developed this concept that basically says the more demanding and the more that you need to change to fit into the environment of work, unless that the healthcare system or the employer cares about you, the more likely it is that this corporate Stockholm syndrome can come to be. And so
Hmm.
even just putting your dial up on that meter and being aware of it and saying, hey, these things that happen, A, they're normal. B, I can recognize them. And C, what can I do about them and really create that healthy locus of control while figuring out who I am in the process too. And teaching that in residency to set the stage for a 3 to 4 decade career that doesn't end up in the dirty B word, right? With burnout halfway to three-quarters of the way through.
Yeah.
Wonderful. Well,
Yeah.
thank you, Don, once again for this conversation. Um, Don Elfenbein, anything else before we close out here and move on to your personal retirement story?
No, I don't think so. Yeah. Looking forward to talking about that.
All right. We'll see you all in next week's episode.
Thanks.
Thank you for listening to this week's episode of the Health and Wellness Podcast. As always, I'm your host, Michael Schwartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwellness.com. We'll see you in the next episode.